cardiac unit cast harsh shadows across Uncle Robert's hospital bed as I entered his room carrying a clipboard and wearing my standard white coat. He looked up from his breakfast tray with the same dismissive expression he'd worn at every family gathering for the past 5 years. "Oh great," he muttered to my Aunt Linda, who was arranging flowers on his bedside table. "They sent the student doctor again." I approached his bed professionally, checking his monitors and reviewing his overnight vitals. "Good morning, Mr. Hoffman. How are you feeling today?" "Like I've been asking for 3 days to see an actual cardiologist instead of whatever you are," he replied curtly. "No offense, kid, but I'm having serious heart problems here. I need someone with real experience, not some resident playing doctor." Aunt Linda looked apologetic. "Robert, be nice. She's trying to help." "Linda, this is my life we're talking about. I don't want some medical student practicing on me. Where's Dr. Peterson? He's supposed to be my attending physician." I continued my examination, listening to his heart and checking his surgical incision from yesterday's cardiac catheterization. "Dr. Peterson is in surgery this morning. I'm conducting rounds for all his patients." "Rounds?" Uncle Robert scoffed. "You mean you're the intern they send around to check boxes before the real doctors make the actual decisions?" "Something like that," I replied quietly, making notes on his chart. Uncle Robert turned to Aunt Linda with exaggerated frustration. "This is exactly what I was talking about at Christmas. My niece goes to some Caribbean medical school, can't get into a real residency program, and now she's practicing medicine at a second-rate hospital." "Robert," Aunt Linda warned softly. "What?" "It's the truth. Sarah, no offense, but you're not a real doctor. You're just some resident they let wear a white coat to make patients feel better. When I need actual medical care, I want board-certified physicians with decades of experience." I continued reviewing his chart, accustomed to these conversations. "Your EKG shows improvement since yesterday's procedure. The stent placement was successful." "See? She talks like she knows what any of that means." Uncle Robert shook his head. "I asked specifically for Dr. Peterson or Dr. Williams. Someone who's actually qualified to interpret cardiac tests." "Dr. Williams is in the cath lab this morning," I explained patiently. "Of course he is. Probably doing real medicine while they stick me with the student doctor." He looked at Aunt Linda pointedly. "This is why I wanted to go to Mount Sinai in Manhattan. Real doctors, real expertise." My pager buzzed. I glanced down. "Emergency cardiac consultation needed in ICU. Dr. Thompson requests Chief of Cardiology immediately." I looked up from the pager. "Mr. Hoffman, I need to step out for a moment. Dr. Peterson will be by this afternoon for his official rounds." Finally, Uncle Robert said, "Maybe I'll get some real medical attention then." I walked out of his room and down the hallway toward the ICU, where Dr. Thompson was waiting outside room 314 with a thick file and a concerned expression. "Dr. Hassan, thank God you're here. We have a 67-year-old male, post-MI, presenting with complex arrhythmias. The electrophysiology team wants your opinion before they proceed with ablation." I took the file and reviewed the patient's history quickly. "What's his ejection fraction?" 25%. "Severe left ventricular dysfunction." "And the arrhythmia pattern?" "Ventricular tachycardia, non-sustained, but increasing in frequency since this morning." I studied the EKG strips and echo results. This patient isn't a candidate for ablation. His cardiac function is too compromised. We need to optimize his medical management first, increase the beta blocker, add an ACE inhibitor, and consider an ICD placement once he's stabilized. Dr. Thompson nodded. "That's exactly what I was thinking, but I wanted your confirmation before overruling the EP team." "Good call. Write up the recommendations and I'll co-sign them. Also, increase his cardiac monitoring to telemetry and recheck his electrolytes every 12 hours. "Will do. Thanks, Dr. Hassan. Your expertise on these complex cases is invaluable." I handed back the file and started walking back toward the cardiac unit when my phone rang. The caller ID showed Dr. Peterson, Cardiology. "Sir, it's Mike. I'm stuck in the OR for another 2 hours. Can you handle the afternoon rounds? I know you've got the research conference call at 3. But Mrs. Chin in 408 is having some chest pain that needs evaluation." "Of course. I'll see her after I finish with the morning patients. Thanks." Oh, and the Hoffman patient in 312, his labs came back. Cholesterol levels are still elevated despite the statin therapy. Might want to discuss lifestyle modifications with him. Already planning to. Great. You're the best, Sarah. Don't know what this department would do without you. I hung up and returned to Uncle Robert's room, where he was complaining loudly to Aunt Linda about the quality of hospital coffee. "Ah, the student doctor returns," he announced as I entered. "Tell me, did you consult with any actual physicians while you were gone, or are you still winging it?" I pulled up a chair beside his bed. "Mr. Hoffman, we need to discuss your test results." Finally. What did the real doctor say about my condition? I opened his chart. "Your cardiac catheterization showed successful stent placement, but your cholesterol levels remain dangerously high. We need to discuss significant lifestyle changes." Uncle Robert waved dismissively. "I'll talk to Dr. Peterson about that when he gets here. I'm not taking medical advice from a resident." "Mr. Hoffman, your LDL cholesterol is 180. Normal is under 100. Combined with your family history of cardiac disease and your recent heart attack, you're at extremely high risk for another event. Look, kid, I appreciate that you're trying to learn, but I'll wait for professional medical advice." Aunt Linda looked concerned. "Robert, maybe you should listen to what she's saying." "Linda, she's not qualified to give medical advice. She's probably reading this stuff from a textbook." My phone buzzed with a text message. I glanced down. Hospital board meeting moved to 2 p.m. today. Need chief of cardiology present for budget approval and new equipment requests. I looked up to find Uncle Robert staring at me expectantly. "As I was saying," I continued, "your current medication regimen isn't sufficient. We need to double your statin dose and add a PCSK9 inhibitor. I'm not changing my medications based on the recommendation of someone who's probably never treated a real cardiac patient before." There was a knock on the door. Dr. Martinez, the chief medical officer, entered with his usual authoritative presence. "Excuse me," he said, addressing Uncle Robert politely. "I'm Dr. Martinez, the chief medical officer. I need to speak with your physician briefly." Uncle Robert perked up immediately. "Finally. Dr. Martinez, I've been trying to get real medical attention for days. They keep sending this resident to check on me, but I need to speak with my actual cardiologist." Dr. Martinez looked confused. "I'm sorry, sir, but who do you think your cardiologist is?" "Dr. Peterson is supposed to be my attending, but he's never here. They just send her." He pointed at me dismissively. "Sir," Dr. Martinez said carefully, "Dr. Hassan is your cardiologist." Uncle Robert laughed. No, he's just a resident. I specifically asked for a board-certified cardiologist." Dr. Martinez looked at me, then back at Uncle Robert. "Mr. Hoffman, Dr. Sarah Hassan is the chief of cardiology here at Presbyterian General. She's one of the most respected cardiologists in the region." The laughter died on Uncle Robert's face. That's impossible. Dr. Hassan completed her residency at Mayo Clinic and her fellowship at Cleveland Clinic. She's board-certified in both cardiology and interventional cardiology. She's also the director of our Cardiac Research Institute. Uncle Robert stared at me as if seeing me for the first time. But she looks so young. She's 34 years old and has been practicing cardiology for 8 years. She's published over 40 peer-reviewed research papers and is internationally recognized for her work in cardiac intervention techniques. Aunt Linda's hand flew to her mouth. "Oh my God, Sarah. We had no idea." Dr. Martinez continued. "Dr. Hassan performed your cardiac catheterization yesterday, Mr. Hoffman. She's the one who placed the stent that saved your life." The room fell completely silent except for the beeping of Uncle Robert's heart monitor. "I came to find Dr. Hassan because the board meeting has been moved up," Dr. Martinez explained. "We're approving the budget for new cardiac imaging equipment that she requested." "Board meeting?" Uncle Robert's voice was barely a whisper. "Dr. Hassan sits on the hospital's executive board. She oversees a department of 12 cardiologists and manages a budget of $50 million annually." I stood up from my chair. "Mr. Hoffman, as I was explaining, your cholesterol management is critical. I'm prescribing evolocumab in addition to your current statin. We'll recheck your levels in 6 weeks." "Sarah," Uncle Robert started, but I was already writing in his chart. I'm also recommending cardiac rehabilitation starting next week. The program includes supervised exercise, nutritional counseling, and stress management techniques. Dr. Martinez nodded approvingly. Dr. Hassan developed our cardiac rehab program. It has one of the highest success rates in the state. Additionally, I continued, I want you to see our nutritionist before discharge. Your current diet is contributing significantly to your cardiovascular risk. Uncle Robert looked completely stunned. Sarah, I don't know what to say. You don't need to say anything, Mr. Hoffman. Just focus on following the treatment plan. Dr. Martinez checked his watch. Dr. Hassan, the board meeting? I'll be there in 5 minutes. I turned back to Uncle Robert. Any questions about your medications or discharge instructions? He shook his head slowly. Good. I'll check on you tomorrow morning during rounds. If you experience any chest pain, shortness of breath, or unusual symptoms, press your call button immediately. As I started to leave, Uncle Robert called out, Sarah, wait. I turned back. I owe you an apology. A huge apology. I had no idea who you were, what you'd accomplished. Mr. Hoffman, you don't need to apologize for being concerned about your medical care. That's normal and healthy. But I was rude. I dismissed you, made assumptions. What matters now is your recovery. Follow the treatment plan, make the lifestyle changes we discussed, and you should do very well. Aunt Linda stood up and hugged me tightly. Sir, we're so proud of you. I can't believe we never knew. It's fine, Aunt Linda. I don't usually discuss my work at family gatherings. But why not? This is incredible. You're the chief of cardiology. I smiled. Because my job isn't about impressing people at family dinners. It's about taking care of patients like Uncle Robert. Dr. Martinez cleared his throat. Dr. Hassan, the board is waiting. Of course. I turned to Uncle Robert one final time. Rest today. Physical therapy starts tomorrow morning at 9 a.m. Don't miss it. As we walked toward the elevator, Dr. Martinez shook his head. Family dynamics can be complicated. That they can. For what it's worth, your uncle is lucky to have you as his cardiologist. That stent placement yesterday was textbook perfect. Thank you. The elevator doors opened and we stepped inside. As we rode up to the executive boardroom, I thought about Uncle Robert's expression when he realized his student doctor was actually the person keeping him alive. The board meeting lasted 2 hours. We approved funding for new cardiac imaging equipment, discussed expansion of the cardiac research program, and reviewed patient satisfaction scores for the cardiology department. When it ended, I had 15 minutes before my next patient consultation. I stopped by Uncle Robert's room one more time. He was sitting up in bed, looking much better than he had that morning. Sarah, he said as I entered, I wanted to thank you. For everything. For saving my life, for your professionalism despite how I treated you. That's what I do, Uncle Robert. No, it's more than that. Linda showed me some articles about you on her phone. The research you've published, the awards you've won. I had no idea. I checked his vitals one more time. Everything looked good. At the next family gathering, he continued, I want everyone to know what you do. How accomplished you are. Uncle Robert, that's not necessary. Yes, it is. I spent years talking about my insurance business at family dinners while you sat quietly, letting us assume you were just getting by. Meanwhile, you were becoming one of the top cardiologists in the country. The work speaks for itself. Does it? Because I clearly wasn't listening. I smiled and patted his hand. Focus on getting better. That's all that matters now. As I left his room for the final time that day, I heard him talking to Aunt Linda. Linda, did you know Sarah has her own research lab? And she's written medical textbooks?